Welcome to the Somatic Nurse Coach certification. We are going to dive into this week into actually having and holding coaching sessions and what does that look like. So you can use ChatGTP or Gemini if you want to create a script for your coaching session, but ultimately it's going to be you that's leading your coaching session. And I want you to do it from a place of intuitiveness. So really listening to the person, asking curious questions and engaging in with that person to understand any limiting beliefs that they might have and even where their root causes might be coming from. And you can do that in one session. Then, when you get that information, you can create a plan to create action steps if they want to work with you for 3 months to 6 months to even a year. So, it is truly possible to have clients that will pay you a lot of money to help them with their life's decisions. You can also take somatic nurse coaching into your everyday life as a nurse. So maybe you're already working bedside. You can take somatic movements into your own body to release stress and bring awareness throughout the day. But you can also help your patients breathe through uncomfortable situations that might put them in places of vulnerability or even uncomfortability. So let's go ahead and dive into this week. But before we start, let's go ahead and begin with a breath practice. Wherever you are, if you're sitting or standing, go ahead and take a moment to feel your feet or your seat on the point of contact. Take a moment to close your eyes, soften your gaze, or take your gaze down. Become aware of the breath by just checking in, noticing the inhales and the exhales as you gently realize how your breath is falling in your body. Taking a nice deep breath in, taking a smile to the face, exhale out. Good. Two more just like that. Inhale deeply. Exhale out. Good. Inhale and exhale. All right. So let's go ahead and get started here. So in your course, I'm going to go ahead and pull it up so you can see what this looks like. So we were talking about what does a coaching session look like? And not only is this important because this is a guide and it can really help you lean into if you're feeling uncomfortable with a session or you don't know where to go with a session, at least you have a guide that can put you back on track. So this is really helpful in having a guide, I guess, having guidance, right? Because nurses, we are so checklisty. And with that comes ultimately not being guided because we have checklists that guide us. So with this is under module 6. We are in week 6. We have 2 more weeks and we'll be diving into business in week 7 and 8 just to help you really kind of smooth out and finalize if you do want to do this or if you want to instill some of the coaching into your business. You can do it part-time, but you can see people for all different things. The biggest thing right now is I want you to start thinking about your problem and solution and how you're going to solve that. But right now, if you're wanting to know how to guide a session, this is a really easy way to guide a session. And it's really dependent on what the person wants. So this is a 45-minute somatic session with clients. And usually those that are in the somatic nurse coach program have some sort of background in yoga, biofeedback, meditation, breath work, energy work, and things like that. If you don't have that, that's okay. You can also bring what you've learned in this course into your coaching sessions, right? Because coaching is about guiding somebody. So it's whatever they need guidance in. All right. So the first part is to prep. And this can just be a gentle conversation like, how's it going? What's going on in your life, right? Tell me something that is exciting that you did this week. You want to prepare a comfortable and safe environment. So you want to make sure they get to a place where they're comfortable and they're able to actually have a discussion with you. If somebody's driving or in the car, have them reschedule that session. Or if they want to take it in the car, that's fine, but they're probably not going to get the most from that session, especially if you're going to bring movement into the session. You want to make sure that you're offering a place of safety and comfortability. Ensure the room is quiet and free from distractions. Like I said, invite the client to sit or lie down in a relaxed position. Start with a brief conversation to check on the current physical and emotional state and any specific concerns or goals for the session. So this is where you can come up with the goals for the session, or maybe you already have a plan for the goals from last week. So make sure you're checking in to see if they had any homework from last week that they're supposed to be doing, or continuing skills building. Next, you want to go ahead and do some breath awareness. So just like we do at the beginning of every session, we just check in with ourselves. It's very simple, but it's a very effective way to actually check in to your current state, the current state that's in your body. So whatever state you're in currently, you're going to be very aware of it once you tune into that awareness and just be like, oh, wow, that's pretty interesting. That's how I'm feeling right now, right? And then you have the opportunity to respond to that body sensations. The next is a body scan. So obviously this is just one way you can do it. There's many ways that you can perform 45 minutes to 60-minute session, right? That time goes by really fast if you have somebody that is on the other side that is engaging with you. Okay, so you can bring in some body scanning with some progressive muscle relaxation. You could bring in some gentle movement, right? Just bringing the arms up and down and around. Just do this a couple times with me. Got it. Bring it up. I want you to feel like you're scooping energy and then allowing the energy to release from the fingertips. So just scoop, release, scoop, and release, scoop, and release, scoop, and release. Good. Come back to the heart center. Just taking the hands to the heart. Take a deep breath in. Exhale out. All right, so that would be some gentle movement. You could also include some yoga movement in there if you like as well. The mindful body awareness is just coming back to the body and being mindful. And you can actually get a lot of things in your handouts in those resource books that I have for you in your course. Emotional check-in. So this is a good time to bring out your emotional wheel, have them check on it, notice what emotions they're feeling. And you can also ask yourself, what emotions are you feeling right now? Just make sure you're checking in with yourself during the session as well. Then the next part is closing and integration. So just gradually bringing it back to the present moment and just asking what they want to start with next time, what kind of goals do they have, how are they feeling, and things like that. So depending on what kind of coaching you're offering, obviously it's going to look a lot different for everybody. This is specifically for somatic coaching. So somebody that's really trying to come back into themselves or become self-aware, these are the type of coaching clients that you would want to invest in your programs. Obviously, you can put any of this pieces and parts and install them into your own coaching practice. So maybe you're a graduate from a different coaching program that is ultimately the greatest because you already have a foundational understanding of what coaching is. This just kind of adds to it and actually helps you process some stuff along the way. So if you have any questions about this particular 45-minute plan, let me know. Again, you can go into ChatGTP and have it write up a 45 or 60-minute session, depending on what you want to reach in that session with that client. All right, so we have closing and integration, homework and self-care suggestions. So you want to provide the client with some ways to check in with themselves throughout the week, whether it's creating an Instagram post if you're a business or marketing coach, or maybe it's actually spending some time with themselves this week, like try to spend 5 minutes with yourself, put a timer on for 1 minute every day and just sit in with yourself, right? So it's just giving them some sort of accountability check-in points throughout the week And that will help them just kind of keep accountable for their own actions. The follow up and scheduling. So I would just say at the end, just be like, all right, when shall we meet next? And try to keep it consistently same every week. This is just going to keep the person more on a habit schedule. Documentations, if you want to take notes, you can. Something that has been very valuable to me now that Zoom has it is it has let me see if I can find it for you guys on here and I'll show it to you. So on Zoom, it's not showing it to you yet. There is like this AI thing that you can use now, which is really helpful. But what it does, it gives you summaries. And so it's really nice because it can give you like the next step. So let me go ahead and share this. This was from a meeting that I had. Um, and this was, let me bring up, actually, let me bring up this one. This was from Karen Dorian's when she visited us here. She did an hour session, and some of you guys were in attendance for that. And let me go ahead and share my screen so you can see it. Okay, so you can see, all right, right here. Um, what this does, it gives you a summary of your meeting, which is really cool. So it gives you like the recap of the meeting. And so you can use this with your coaching clients, especially if you use Zoom. I don't know if it's on Google. It might be. It probably is. But see, you can see the next step. It says attendees to practice rest and decision-making process, incorporate intentional rest practices. So this could also help too in what the next steps are for that person so you can give them homework. And then it also just gives you a summary of kind of the points of connection during that session. And it's under summaries in Zoom. There are a couple other things on here that you can use, like recording and transcripts. Recording and transcripts also, stop sharing. Recording and transcripts are also really helpful too, because you can always take things out of the transcripts. If you're like, I can't remember what the meeting was about, you can just skim the transcripts really quick, and that can help you as well with your client. All right. So that is kind of an example of a 45-minute session. I know that was like short and sweet, but ultimately, you want to help people with what they're needing help with, right? And usually it's because they found you because you have a solution to kind of their pain point or their problem. And now understand that you have to build credibility, you have to be consistent, right? You have to find some way to share your story with others. So it's really important that you just maintain the know-how that there is no shortcuts, that this is kind of a process. Now, I know you might have not been told this, but you do want to charge for your sessions. Now, what is the best way to do that? You can do hourly or you can do package sessions. So sometimes you can get things done quicker in shorter amounts of time, but you can still apply the principle that my knowledge is still worth 6 grand if it's 30 minutes or 5 days, right? So it's ultimately up to you to learn and earn what your price point is going to be for your programs. Okay, that was the script. Now let me go ahead and open up. Okay, perfect. So on here we've got Module 5, empathetic listening. This is going to be really important. This is a really good video for you to watch. It's inside out, so I definitely would dive into that. And, with empathetic listening, it's important to open up to those of us that have clients to be curious of what's going on and for them to be curious of their own behaviors. So, these are some somatic movements that are very beneficial for regulating the nervous system. So, as we know, stress is usually directly related to our nervous system and the dysregulation of it. So, we can start with some neck rolls, and it's just literally taking your neck from side to side. Just do a couple of those. Maybe notice where it's a little bit tight. Good. So that's neck rolls. Next are shoulder rolls. So that's just bringing your shoulders up, dropping them down. Spinal flexion and extension. So this is just bringing your shoulders back and then bringing your shoulders around. Bring your shoulders back, bring your shoulders around. Just doing this a couple times, opening up the chest. Breath awareness is obviously focusing on your breath. We've got pelvic tilt. So this is when you stand up, you tilt your pelvis forward and then tilt your pelvis back. Tilt your pelvis forward, tilt your pelvis back. You can kind of do it while you're sitting and tilt your pelvis back. Somatic grounding is just connecting with a point on the ground. So standing on the ground with your feet, shoes off or on. Gentle twist, it's just twisting side to side. Hip circles, right? That's your hula hoop. Mindful walking. This can be done when you're at the hospital or when you're walking into the hospital, or just walking through the grocery store throughout your day. You can notice your feet on the ground. So that is specifically some of the somatic movements. And you've probably been doing a lot of these somatic movements already in your life. They just weren't called somatic movements, right? They're called like calisthenics. But those are some somatic movements. These are all from John Hopkins trained somatic masters, and you can check all those out as well. Care of the somatic nurse coach. So with this ultimately is care for the nurse in general, right? Because burnout is being thrown around so much right now, but that is totally a word that's being used, and it's real life that these things are happening. So, how can we help ourselves as nurses and as humans? We can do a couple things. So, we can dive into just understanding that we are a whole body system rather than systems within a body. We can also understand that our mind and body are connected. It's constantly talking throughout our body what our body and mind needs. Many of our health issues come and stem from emotional issues or trauma that has impacts on our physical and mental health. So, the preventative care would be addressing the whole body connection, where somatic nurses can engage in that preventative care. And you can ultimately do this by preparing yourself with a session with a client, right? So, you can prepare yourself at the beginning with the client. If you're even feeling frazzled, you're going to take some deep breaths and get prepared as well. You're going to enhance patient caregiver relationships. So, as we understand the whole body, we connect with other people on a human level rather than seeing them as a diagnosis or even a dollar bill sign. Why somatic nurses can stay regulated. So, seek supervision and consultation with experienced somatic practitioners. So, if you guys ever have any questions, please feel free to reach out to me and I can help you with that. You want to make sure you're staying informed on the latest developments of somatics and bioscience and things like that, just so you're able to be at the forefront in the future of somatic nurse coaching. You want to make sure you're regularly reflecting, that you have boundaries and self care, mindful work environment, and incorporate movement throughout your day. So just taking moments to stretch and move. Oh my gosh, are you? Oh, excuse me. So, in your journey of somatic nurse coaching, it's ultimately focusing on you, right? Focusing on you, focusing on your habits, focusing on your nervous system, and getting your nervous system back into a regulatory state, which is so important. So, as we move through these next couple of modules, you want to start to notice and kind of start to wake up. And notice if you are becoming more aware of your surroundings and more aware of your internal dialogue as well. So if you have any questions this week, please let me know. I will be doing some one-on-ones with you guys, so please feel free to reach out to Let's Connect to do some one-on-one coaching so you can ultimately put this into practice as soon as possible. Because in the next couple of weeks, we'll be talking about business as well and the opportunity to join the Nurse Stream Lab as well. All right, well, have a great day and take care, and I'll see you next time.